Good morning, everyone. This is Dr. Gopinath, Associate Professor from the Department of Community Medicine. So today we are going to discuss about the class measles, which is a very important communicable disease. So coming to the introduction part, it is also called as rubeola, which means red spots. It is considered as a highly infectious viral disease belonging to myxovirus groups. And especially it is common or only seen in humans, not other bovines or any other considered to be any other zoonotic disease. It has very high morbidity as well as mortality in developing countries, and it is very important uh, cause of mortality under 5 age group children. To be precise about this burden of the disease, it is considered endemic in most part of the world, but it can be seen as an epidemic uh, when the proportion of susceptible children reaches about or more than 40%. Whenever it is introduced in a community where there is no previous exposure of measles, and more than 90% of this community can be infected. What are the challenges we are still facing in measles elimination? As we know, still it is considered to be part of a national immunization schedule. This dosage, vaccine, measles vaccine, to be given at the end of ninth month. So, because weak immunization system of our body, high infectious nature of this measles virus, of course, increasing refusal of immunization or vaccination by some kind specific population. Also, this changing epidemiology of measles, like it is a virus, there is always a change in antigenic shift and drift. Of course, the gap in human and financial resources, depending on how much they are spending into the health sector, especially for vaccination. And let us see the epidemiological triad, which consists of determinants, host, and environment. First of all, agent, it is caused by RNO paramyxovirus, where source of infection is always a case of measles. And the source material, like infective material, is the secretions, especially from nose, throat, and respiratory tract. And the communicability is very highly infectious during the prodromal period and the time of eruption, and therefore the communicability declines follow the appearance of rashes. Last are nothing but the less than 3 years of age children. More or less sex determination is equal, and immunity is one attack of measles confers about lifelong immunity. So that is why we are having those measles vaccination. And of course, malnourishment is very pivotal in acquiring this measles virus, because undernutrition children are very prone for this measles infection. And there is no proper season, preferably, but especially it can be seen during the cold climate. Transmission, we all know, it is mainly by person to person through droplet infection, and from day 4 before the appearance of rash to 4 days after those rash is the incubation period or the communicability period. The portal of entry is always through respiratory tract, and it can also spread through conjunctiva. Clinical features, those divided into 3 stages, especially prodromal, eruptive, and post-measles stage. And the period will be from 10 days from the exposure of the onset of fever, and 14 days after exposure to the onset of rash. So what is called the prodromal stage? It begins 10 days after the infection, lasts until day 14, so which means around 4 days, which have fever, coryza with sneezing, nasal discharge, cough, redness of eye, photophobia, even lacrimation. There is one important sign called Koplik spots, where it appears a day or two before the appearance of rash in oral cavity. Red macula papular rashes, and usually it begins behind the ears and spread rapidly in hours, and it will take a maximum a day, so that it will spread through face, neck, and throughout the body to lower extremities. And the lesions and fever usually disappears within 4 days. So during prodromal phase, in the first 2 to 5 days of rash, the virus is very much present in all secretions of our body, especially tears, nasal, throat, urine, as well as in blood. And this post-measles stage is considered to be every other viral infection stage, where it can cause weakness, weight loss. It can have a condition extended to chronic illness because of the persistent nutritional and viral infection related effects. And moreover, in very young age, children can lead to diarrhea and even growth retardation followed with malnourishment. You can see one and all symptoms as a whole: fever, non-productive cough, and a running nose with sore throat, and the conjunctivitis, even rash, and all other constitutional symptoms. Complication is considered one of the main reason to why we are still giving vaccination. So there is still 30% reported cases. What are the risks? Basically, they define as, like I told, it is aged less than 5 years. Children are very much prone, and wherever there is overcrowding and malnourishment present, definitely this the incidence of measles is always higher. And of course, many immunological disorder where the immunogenicity is usually low in our body, it can happen. And other complications like otitis media and laryngotracheobronchitis and pneumonia and diarrhea all has its share in this complication. Well, the vaccination is considered one of the primary prevention in controlling this disease, which is having at least 20 to 30% of mortality in under 5 age group. So also there is no specific treatment as we discussed. Only vitamin A along with vaccination at the end of ninth month. Dosage of 50,000 international units less than 6 months, and between 6 months to 12 months it is 1 lakh international units. Anything more than that for with the 2 lakh international units can be considered as a proper preventive aspect in this measles. So there is no as such specific treatment apart from vaccines. So it is considered to be a life-saving vaccine, where it is a freeze-dried product, should be used within 4 hours of reconstitution, and the storage is almost 2 to 8 degrees Celsius, where it is always to be given in right upper arm as 0.5 ml administration. So still there are many vaccination to be given with MMR vaccine and being replaced with the MMR vaccine by government related thing. But anyway, everyone is giving those vaccination at the end of 9th month. So it is basically a live attenuated vaccine where it has more than 80% to 90% efficacy. Thank you so much.